is Curriculum Tools for Discussing Race and Racism in Midwifery. We are very lucky to have 3 presenters today. Kim Q. Doe is the director of the UCSF Nurse Midwifery and WHNP Education Program. Her interests include the intersection of midwifery, health policy, inequities in healthcare, and healthcare outcomes. She believes that including curricular content on the impacts of racism can ensure that midwifery is better positioned to respond to persistent health disparities. Brittany Edwards is currently completing her first year in the CNM WHNP graduate program at UCSF. She is from Fresno, California, and has a background in asset-based community development as a bilingual educator, doula, and nonprofit coordinator. Brittany attributes her passion for equity and education to her grandparents, who founded their city's African-American newspaper. And finally, we also have Leandra Santos, who is a new-to-practice midwife in Philadelphia, who identifies as a multiracial Latina, born in Peru and raised in New York City. Throughout her nursing and midwifery path, she has worked to make these career paths welcoming to students of color as a way to develop quality care for Brown and Black communities in the United States, including co-authoring a curriculum for the nursing school, which discussed the detrimental effects of using the social constructions of gender and race as biological markers in nursing practice. Thank you so much to our 3 presenters. I'm going to go ahead back now to our presentation and turn it over to you.
Kristin, thank you so much. This is Kim Doe, and before we start, I just wanted to take a moment, Kristin, and personally thank you for all the work that you're doing. I was just sharing with Brittany that this is the most organized presentation that I have ever attended, and you pay such careful attention to detail, and it's much appreciated. And even more than that, Kristin, I want to publicly acknowledge the oodles, the hours, tons of work that you've put into the Equity and Midwifery website, developing the series and the phone calls. What you're doing is transformational, revolutionary, and just amazing. So thank you for that, really. And I also wanted to say thank you to my co-presenters, Brittany Edwards and Leandra Santos, who have been amazing to work with, inspirational, and I'm grateful to have been your partner in developing this. So thank you. Next slide, please.
I do hear you there, and I'm gonna try to make that happen. There we go.
Great. So just starting out for a little bit of background for our presentation, we wanted to start with a bit of a discussion on race and racism in midwifery more broadly. And to do that throughout the presentation, we often go back to the phrase midwives of color, and wanted to set up in the beginning an acknowledgement that even though this phrase, this term is used multiple times, midwives of color, students of color, people of color, we realize that it's a phrase that has its limitations in that it lumps together many different identities of people of color, and that in some circumstances, there are very specific identities that are impacted, and it would be important to name those experiences. So our choice of using midwives of color was one based in feeling like it was the best one to serve our purposes, but do want to acknowledge up front that it's not a perfect term. Next slide, please. Oops, I think it may have gone backwards instead of forward. Perfect, thank you. So first want to start out with saying that it is some of our values or some of our assumptions as we developed this presentation. We believe that it's imperative that midwifery meaningfully integrate anti-racism into the curriculum for several different reasons. One, we think that if midwifery curricula addresses anti-racism directly, that it'll improve the way that the individual graduates can provide client care upon graduation. We also think that thinking from a broader perspective, it helps to embed the elements elements of justice and health equity into the midwifery model of care. I think that being very explicit of how health equity and justice tie into the midwifery model of care is an essential way to ensure that our graduates are embedding it themselves. And then finally, it is absolutely true that the systems, that racism is prevalent in healthcare as much as it is in education. Healthcare and education are two institutions that have a long history of being exclusively available to privileged populations. And so in thinking about how we create anti-racist curriculum, it is about changing healthcare outcomes, and it is about addressing health disparities, but it is also very much about creating a space where more midwives of color can be seen and well supported. Next slide. Some of these statistics are probably not unfamiliar to you. We know that despite a rich history of having midwives of color in this country, the current demographics of midwifery are largely white. 92% of American College of Nurse Midwives members identify as white. In 2014, 22% of the CNM-CM students identified as students of color, and the NARM survey identifies 21% of their respondents as midwives of color. So drastic differences between ACNM and NARM, and some promising numbers in terms of the CNM and CM students of color. But I want to acknowledge that this is not just about increasing our numbers. This is not just about getting those percentages higher. It's really about thinking, how do we make midwifery more equitable in general, and keeping in mind that the reason these numbers are the way they are now, despite the history of midwives of color in this country, is an erasure of those midwives of color. That in this country, midwifery as a profession, we know that midwives of color were eradicated by practices of medical societies in that time. But you know, the reasons why we still have a predominantly white practicing profession has to do with it's our own responsibility as a profession now. Next slide, please. For the next couple of slides, I wanted to invite each of you to consider what is the climate of race in your midwifery classrooms currently. And I want to acknowledge that sometimes the classrooms are brick and mortar, face-to-face, and some of them are online environments. I'd ask you to consider, take a moment and think about, how are race and racism typically addressed in your classroom? Are they addressed? Are they addressed in such a way that they only come up in discussions of health disparities, or race as a risk factor, or race as associated with lower socioeconomic status? Consider, what are the ways that we discuss the race of our clients? Do we address the race of the people that we care for in whatever setting that you are? In what ways? What do those specific discussions entail? In thinking about the images that are presented in the classroom, either, you know, people talk about the physical space, what's hanging up on the walls, what's being shown in the presentations, the PowerPoints. Could students of color see themselves in those images? Do they see positive images of people who look like them? Next slide. And now I'd like us to pause and think about, what are the dynamics that are created because we tend to have a lack of diversity in the midwifery student body? How many students of color do you have in your classroom? Do those students often get turned to as tokens or representatives of their race? And how does the lack of diverse faculty impact the dynamics? Going back to the question earlier about how is race and or racism addressed in the classroom, would that conversation look different or feel different if we shifted the percentage of diverse students, or if the faculty was a faculty of color? Consider the power differentials that are going on in the classroom as well, and how those are impacted by that ratio. How does that power differential impact the conversations that are taking place? What's said because of the people that are in the room? What's not said because of the people that are in the room or the people that are missing? Next slide, please. So our presentation really is intended to build off of an earlier presentation through this series. And we do think it's very important that each midwifery program sets a curricular foundation in race and racism. But our presentation is going to focus on how do we thread that content throughout the entire curriculum. Next slide, please. So the previous webinar was led by Wendy Gordon and Sophia McCarter. It's available on the website, and they did an excellent job of talking about anti-racist coursework that they established at Bastyr. And if you haven't gone through it, I think it would be well worth your time. And for those of you who haven't listened to it yet, I think the main points that I want to make about having a foundational coursework is it's important if you're going to talk about race and racism throughout a midwifery program, it's important up front to establish shared definitions. It's important to have an exploration of fundamental frameworks and theories, and also just to get the epidemiology out there, describing the inequities as they exist nationally, globally, and putting some numbers into the story. Next slide, please. One of the most essential pieces that I think in setting the foundation for the rest of the program is defining race and racism. And it seems very basic, and I think that we all go around assuming that we are all on the same page about what these definitions are. And in my experience, I've realized that we have many different varying definitions of race and racism. And in order for us to keep talking about them and reflect upon them and the impact of these concepts, having an exploration of what people's different definitions are is important, and also trying to move towards a single definition that everybody could use. So for example, some of the concepts that we focus on at UCSF, we're not a colorblind society. We describe race as a social construction, not as a biological. And we don't shy away from conversations about power and privilege. Power and privilege, and I know I'm speaking to an audience that's probably very savvy about this, but there are multiple resources on the Equity Midwifery website available on power and privilege specifically. Next slide, please. One thing that in my personal journey I've encountered is somehow when I initially started talking about power and privilege as it relates to race and racism, it was really challenging for me until I was able to make a connection to the conversations we have all the time about power and privilege in midwifery. I think this slide probably speaks for itself. We talk about power and privilege already as it relates to birthing people and childbirth. And it's just a matter of extending that conversation to race and racism. Next slide, please. And then just quickly, some of the other things that I think, in addition to race and racism, that are important to establish in a foundational course at the beginning of the program would be discussion of historical and modern oppression in marginalized groups. One of the ways that we're applying that at UCSF is looking at the communities where our students are doing clinical rotations and getting more information about the economic and social history of the communities there. We want to draw out the relationship of racism directly to disparities, looking at health outcomes, looking at healthcare delivery. And then finally, as I mentioned before, introducing theories and frameworks. Having theories and frameworks to go back to throughout the curriculum, I think will help provide grounding for students throughout the rest of the program. Next slide, please.
Excellent. Thank you so much, Kim. So here we would like to define 3 different theoretical frameworks that will be foundational concepts for our discussion today. They are critical race theory, structural competency, and reproductive justice. This will be the jumping off point for our class. These concepts help us address the relationship between health, social systems, and racism. Some students have heard of these terms and concepts before, others may not. But they are foundational to understand the objectives of our objectives, including race, racism, and midwifery education. Next slide. So the first, critical race theory, it was developed in the 1970s by a group of lawyers, activists, and legal scholars from Harvard Law who are engaged in studying and transforming the relationship among race, racism, and power. It builds on previous movements of radical feminism and critical legal studies, where not every case has one correct outcome. So its key elements are, first, racism is ingrained in the American society and a common experience of most people of color. CR critical race theory challenges legal discourse, states that law is neutral and colorblind, as Kim was speaking about. It challenges these terms such as post-racial society that make it difficult for midwives even to acknowledge and address racism. The second, oppression is multidimensional. Through this term called intersectionality, which may or may not be new to you, we see these intersections of ethnicity, race, class, national origin, and sexual orientation that can provide unique expressions of oppression that a person can experience. Third, the term race is a product of social thought and relations. So we know that there is no biological or genetic reality. We know that races are categories that society invents, manipulates, or retires when convenient. And four, narratives and experiences of people of color must be shared. These stories challenge the dominant narrative and have been silenced by power and privilege. So critical race theory raises the importance of storytelling and oral traditions to preserve the history of marginalized groups. Next slide. So how does this apply to our midwifery education and practice? We know that students of color have their own personal experiences around racism, and students can experience multiple times during the day experience racism, and they also bring that into the classroom. There may be less overt ways or even more overt ways that a student can experience this, but the impact is real, and it does have implications in the classroom. Second, these intersections of identity for not only students, but our clients that we serve, where patients and clients have different layers of oppression. An example might be that a white woman who can experience discrimination on the job because she is a woman. An African-American woman can also experience discrimination for being a woman, but also for being a Black woman. and she is if she happens to be in a low income community or presents as queer, the oppression is experienced at even different and greater degrees. And also, let's thinking about our own midwifery history. Just the dominant narratives told of our midwifery history in the United States excluded stories of granny midwives and indigenous midwives. But by listening to their stories, we can learn and appreciate the whole story of midwifery, that these midwives also helped not only deliver, but nurture and breastfeed our nation in its infancy, thinking throughout slavery and to this very day. So the diversity of midwifery practice has always existed. However, those stories have been silenced. So it's important for our midwifery education to include these stories. Next slide. The next one is, our next framework is structural competency. And so the quote at the top says, it's a capacity for health professionals to recognize and respond to health and illness as the downstream effects of broad social and economic structures. So these key elements are recognizing influences on structures on client health, also recognizing influences of structures on the clinical encounter, including implicit frameworks common in healthcare. So example of this would be the thought that our patients, our clients are the most responsible contributor to their health is maybe the individual behavior and genetics, which is not true. The third is responding to structures in and beyond the clinic. And fourth, structural humility. So it's important to note the difference between cultural competency and structural humility. We've probably heard of cultural competency or structural humility a lot, maybe within our education. But cultural competency is the ability to respectfully communicate and deliver appropriate and effective care to people from various cultures and backgrounds. However, structural competency takes this concept a step further by identifying and responding to systems and institutions that affect the client's presentation. Next slide. And applying this to education and practice, this is very important. Our first point, structural and institutional racism impacts access to education and healthcare. So when we think about our application, acceptance, and retention rates for students of color into midwifery schools, we know that they're low, as Kim shared those statistics in the beginning. Not because these students are less capable of being midwives, but because there are structures in place that decrease availability and access to these resources. And so as midwives, many of us practice in clinics and hospitals with large client populations of people of color. What structures that we see can impact our clients? So just thinking even about the waiting rooms that a client sits in, how long do they have to wait for a 15-minute appointment? How far do they have to travel? And after hearing our spiel, maybe even about healthy foods or exercise during pregnancy, do we know if they have access to even grocery stores and fresh food? Do we know if they live in a safe neighborhood, even free from violence and able to exercise and walk around? So cultural competency would fall short here because culture does not explain the inequity that we see. So structural competency helps midwives understand the downstream effects of social and economic structures on our students and clients. We can use our privilege to lift up those impacted most by these oppressive structures. Next slide.
Hello, this is Leandra. I'm going to jump on the presentation now, just explaining about reproductive justice. So this is our third framework we will use for foundation, and it is because it is relevant to midwifery education and practice. Reproductive justice is not just a theoretical framework, but a political one. It was created by a group of women of color in the 1990s during the International Conference on Population and Development in Cairo. It was a response to having a women's rights movement that centered white and middle-class women's voices, and therefore not doing enough to fight for the right of people of color and their families. Loretta Ross explains, it is that reproductive justice is based on the understanding that the impacts of race, class, gender, and sexual identity oppressions are not additive, but integrative, producing this paradigm of intersectionality. The key elements of reproductive justice are fairly simple. They are the right to not have a child, the right to have a child, the right to parent a child in a healthy and safe community. So for these rights to exist, we must first understand the intersectional way these rights have been taken away or are limited or are currently limited by government and healthcare. So the way this applies to midwifery education is mostly because, by definition, right, reproductive justice follows the arch of the midwifery curriculum of gynecology, right to not have a child, right to have a child, antepartum, right to have a child, intrapartum, right to have a child, postpartum and newborn care, which is the right to raise said child in a healthy and safe environment. And so, and also it could be used to contextualize the way these rights have been withheld from people of color all over the world in the hope of stimulating solutions to these inequities. Next slide. Oh, I'm sorry, next slide. We're two more slides down. One more, yeah. And the way this affects midwifery practice is bringing reproductive justice into midwifery practice is necessary when caring for our clients because it is based in intersectionality. Thus, it explicitly states that an individual's multiple identities ultimately shape their lived experience inside healthcare, especially in reproductive healthcare. Ultimately, this understanding the way power and privilege flow, we as midwives can promote a healthcare system that respects the autonomy of all of our clients and their families. Next slide. So once we have a shared foundation, some of these theories down, midwifery students and structures, for all of us midwifery students and instructors, it would be hard to not recognize the importance of unpacking race and racism in midwifery education. A tool we propose in this presentation is called curriculum threading. Next slide. So curriculum threading is the process of intentionally weaving content on race and racism throughout the midwifery curriculum. It is a response to having an isolated, diverse, so it's in direct opposition to maybe having an isolated diversity, race, special population section of the curriculum. This tool asks for educators and learners to organize knowledge around themes of a persons of color experience in midwifery care throughout every semester. We find this tool to be powerful for two reasons. One is because it prepares midwives to respect the autonomy of all people. As midwives, many of us are doing our part to raise the standard of care for all women. However, can we say that all of us are actively working to close the health disparities that fall along race lines in our country? The disparities are alarming, and many of us know the numbers and statistics. Curriculum threading will give students the room to discover how and why the experiences of people of color in healthcare have been different and continue to be different, and how all of those things are connected to midwifery practice. The second reason I will highlight that we find curriculum threading to be so powerful is that it promotes an environment of respect and recognition for students of color. Midwifery students of color, their families, their communities, and ancestors have been personally affected by healthcare inequities in this country. It is important to give time to explain the complexities of these experiences so as to not reduce our experiences to statistics and health epidemics. Next slide. For the next couple of slides, I will give examples of threads instructors could use in their midwifery curriculum. The first step would be to identify themes that illustrate the pervasiveness of racism in midwifery care and thread those themes throughout the curriculum. The examples I will use in this presentation are the following: medical mistrust, embodied racism and its health effects, criminalization of parenting, and family making. There are more examples of how race and racism have affected obstetric and gynecological care in the United States. The reference list at the end of our presentation offers some articles that could be helpful in framing different types of conversations. Next slide. Medical mistrust is an important concept when we discuss the effects of racist medical practice in our everyday interactions with our clients, especially Black and Brown clients. As healthcare providers, we have to own the ways history and past actions have shaped the way clients see us in their communities. So beginning in gynecology, we could talk, Black women and men have been subjects of medical experimentation, and it makes sense that their relationship with gynecological care would be complicated. We can look back to 1947 with the Tuskegee syphilis experiment, where we conducted a clinical trial on syphilis by infecting Black men in Alabama and eventually withholding proven treatment of penicillin from some infected individuals. There's also James Marion Sims, who some people would call the grandfather of gynecology, and who used female slaves to develop speculum and practice surgical techniques on said slaves. In antepartum, we can also talk about how some clients can see us as gatekeepers of pregnancy because of events that have occurred in the past. In the 1960s and 70s, Mexican women and women of Mexican descent were given tubal ligations without consent in Los Angeles, and most recently, incarcerated women in California were coerced into sterilizations. These are only a few instances of population control that have happened in the United States. And it is important to highlight, since it is the setting in which midwives discuss contraception options, including LARCs. In intrapartum, we could discuss the instances of court-ordered C-sections. I cited an ACLU article in the reference list, which talks about the specific cases in the 1980s of forced court-order C-sections. But it also mentions that in 1987, there was a New England Journal of Medicine study which remarked that 81% of court-ordered C-sections were on low-income women of color. This again provides context provides context to the discussions we have with our clients regarding birth options and access to birth settings, right? Medical mistrust could then circle back to professional issues and talk about interracial dynamics of providers and clients, including white providers. What does it mean to have be a white provider with a client of color, or providers of color with clients of color, or any of those permutations? Next slide. In Embodied Racism and its Health Effects, this is really a reframe of discussions of race as a risk factor. So it isn't because we are Black that we are more likely to have preterm birth, and it isn't even because we're Latinas that we are going to have diabetes, right? What we're offering is a different way of thinking about health disparities. However, it is important, like Kim said, to discuss the way health disparities affect the lives of women of color disproportionately in the United States. Get all that out there. There's still very staggering the rates of survival rates in ovarian, endometrial, and cervical cancer are so much lower in Black women than white women. In intrapartum, we see higher numbers of preterm births, C-sections, and infant mortality in Black populations compared to whites in the United States. This theme can offer different ways of talking about these health disparities not through a frame of genetic predisposition, but instead discuss the structures that produce these disparities. And ultimately also we can include new research that highlights the way stress of discrimination and racism could have negative health outcomes, including preterm birth. And in professional issues, ultimately, we can discuss how to push our professional organizations to fund this type of research, how racism affects the health of our clients. All of these facts need to be discussed in their pertaining semesters so that midwifery students could internalize what they see in clinic and help students understand that it isn't race, but it is racism that produces these health disparities. Next slide. Criminalization of parenting and family making. With this theme, a midwifery instructor begins to highlight the interconnectedness that midwifery has outside of the birth parent and the newborn dyad. This dyad, after all, belongs to a larger family, a larger community, and must interact with larger societal structures. So again, it follows the same arch that midwifery curriculums kind of follow, right? So we talk about, in gynecology, we could talk about how Medicaid recipients have additional restrictions to reproductive choices. This could include the way the Hyde Amendment prohibits federal money to fund medically safe and legal abortions. And it could also include the way the 1990s welfare reform limited government assistance when families had more children. And in antepartum class, we could discuss recent fetal assault laws that were passed in some states that basically allows for women to be charged with assault of a child if they were found to be using drugs while pregnant. We need to discuss questions there about what is the relationship that midwives as prenatal healthcare providers, what should our relationship be to these types of laws, and again discuss this during our education and how it would affect our clients during in the setting of those laws. When discussing interpartum and postpartum care, it would be important to discuss recent publicized police killings of unarmed Black youth. How does the death of Tamir Rice or Michael Brown affect future parents of Black children? How do we as midwives respond to an environment where Black life can be destroyed so swiftly and inconsequentially? These are, again, things we should think about as we're preparing midwives to go out and practice and work with clients who have these questions at the forefront of their minds. After all, this is what would affect the individual health of our clients. And this is the setting in which they're making choices to parent or not to parent, and the climate in which they're raising their families in the United States. Next slide.
Thank you, Leandra. So I want to bring us back to the dynamics in the classroom space. Leandra just did a phenomenal job of outlining some topics that can be threaded through different coursework. And I think that as we dive into these really critical yet heavy, intense topics, that we take a moment to reflect on how that conversation is impacting the people that are in the classroom. How can we, as educators in particular, be aware of the experiences that students of color are having as we're having conversations about their lived experience? And again, I'm wanting to reflect that not in all, but in many midwifery classrooms, the number of students of color is a very low percentage compared to the number that identify as white. Next slide.
Great. Yeah, so it is important to remember that there is no single student color of experience. As a student midwife myself who identifies as African American, I could speak to my experience. And I know that classroom settings have the potential to become uncomfortable. It's very difficult to hear professors present negative perinatal outcomes, such as high preterm birth rates, preeclampsia, and even mortality rates that are associated with your own identity group, with no time spent on history, background, or reasons why this phenomenon could be happening. I can remember an experience during nursing school. Although the professor may have had different intentions, it felt like what was being threaded, as Leandra was talking about this threading, what was being threaded into my education was that Black people are victims, are weak. They don't know how to take care of themselves, are less educated, and they need to be saved. It was incredibly hard to go to class. So I thought about how the situation would be different if the faculty maybe identified as a person of color, or what kind of conversation could we have if the faculty identified as African American even. I wanted the realization of resilience in my culture, not just a presentation of our risk. And so it's important to remember that disparities are not a sign of weakness. In my opinion, maybe a testament to our strength in spite of the oppression that we experience. It's extremely helpful when a professor is sensitive to a student's experience and is aware of the classroom dynamics, as Kim and Leandra were speaking about. Sometimes the students of color need space to share even by themselves. Actually, I remember a great course we took last year in our midwifery class. It was called Health Disparities, actually led by our co-presenter, Kim, and my director. We actually had the opportunity to break up into groups of similar backgrounds. And so there were four other women who identified as African American in that class. And it was really healing for me. I felt very comfortable to share in a space where people who identified like me. And it felt a very healing space that we had. And I had wished, that we could have done it maybe in the other classrooms as well. And so I also wanted to make mention that there is also a space for white students to do their own healing and own learning, and to be aware of the time spent processing maybe new concepts in the classroom, such as implicit bias or microaggression, that may sometimes burden the student of color the students in the class who are listening to the experiences of white people processing, which is also an experience of a student of color. Next slide.
So as educators, I think that this is a good opportunity for us to focus on the strengths-based approach to education and think about how that applies to what Brittany is describing. We're responsible to ensure that all students are given the space to flourish in the classroom. And in the context of this presentation, I think it's important to remember that unconscious bias can lead to seeing race as a personal weakness or deficiency, as Brittany said. A presentation of race in the classroom that only discusses race in terms of disparities risks two things, maybe more. Casting people of color as less than whites, a consistent, reiteration of the disparities, and two, reducing individuals down to just negative statistics and removing their humanity. Disparities can't be the only context in which we as educators discuss race in the classroom. And, tied to this idea of strengths-based education, we are striving to find ways to empower our students, our learners, to flourish as opposed to just surviving. We're looking for ways to celebrate their strengths and not focus on weaknesses or deficiencies. So we want to spend time also celebrating what students of color and the history of people of color, midwives of color have brought. Reflecting back on critical race theory and the importance of personal narrative, you know, I think that it's important we have throughout the curriculum stories, first person stories of midwives of color. There's a number of resources and books for detailing the stories of granny midwives in this country, the history of Latina midwives, the history of the immigrant midwives that have come long before us. Next slide, please. So we're going to shift gears a little bit. We spent some time talking about core elements in a foundational course. We spent some time going over, in particular, theories and frameworks that we think should be included in a foundational course. Leandra went over a number of ideas for threading content throughout the program. And now we're going to shift gears to talk a little bit more about practical how-tos. How do you deliver the material? What tools are available to you? What you might want to seek out to develop your own strengths as a faculty member. Next slide, please. So in terms of classroom tools, this is a series of ideas that you might consider before you teach any of the courses, the foundational or the threading. First, I think it's important to do a self-assessment, and I think we're all constantly assessing our strengths and our challenges. And I think in particular, as you're planning changes to your curriculum, if you're planning to include content on race and racism that you haven't talked about before, that you may not feel comfortable with, identify what are going to be your strengths in including this content, and what are the things that you might need support from your community to strengthen your skill set. At the beginning of the program, it may be useful to do a survey of all of the students that will be entering into the program, get a sense of which students are already very knowledgeable about race and racism, or race and racism as it impacts health and healthcare. How comfortable are people in talking about the topic? So even if people have maybe done a lot of reading or very familiar with the content, it certainly doesn't necessarily translate to a comfort in conversation, especially in a space with individuals that they may not have met before. In doing a survey early on, you can identify the variety of quote unquote experts or newbies and create learning space for both people. As Brittany mentioned, I teach a course here at UCSF on racism and health disparities. And one consistent piece of feedback that I've received is that it is very hard for when students are coming in at very different levels of understanding, it's very hard for them to interact. So for example, if you have a subset of the students that are very comfortable in talking about these things, they may end up dominating the space. And because of because people tend to have a lot of fear in talking about race and racism, others in the class may not engage, and that may then of course impede their ability to learn fully the content. It is essential to set expectations around communication very early on, and then throughout the program. Set ground rules. I recommend a development process that's done by the group. Sometimes you could, as a faculty member, come into the space with ideas of what basic ground rules you want to make sure are included. But I think that it's important that in a step of building community, that we allow the participants to set their own ground rules, set their own parameters, because they will be responsible for helping to keep each other accountable. Although not to say that the faculty I want to make really clear, I do believe that the faculty member has to still maintain the highest level of accountability in monitoring the communication processes. In setting the ground rules around communication and expectations, I do think a critical element to highlight is the necessity and normalcy of conflict when we communicate. Conflict, I make sure we say out loud, conflict is healthy. Conflict shows that we're working through our ideas, and we can do so respectfully. It is important for us to be kind to each other in these conversations, but we don't have to be necessarily nice to each other. And I think that the distinction for me is that we need to be honest. We need to continue to be honest and do so in the context of respect, clearly, but we don't need to allow any biases to continue to go unchecked in these classroom spaces. Next slide, please. As I mentioned before, in the readings that you bring into the class, make sure that you include not only papers on theory, papers on research, but bring in human stories. I bring poetry into the classroom. You can find narratives, stories of people who have experienced discrimination. It is so important. I know we've said this multiple times in this presentation, but it's so important to keep these issues human and personal. It makes it more accessible for those students who have had a privileged experience and have not had a lived experience of discrimination or bias. Written reflections have been a really useful tool in the classroom, I think, in keeping in mind the different types of processing that each student is going to need to undertake in these conversations, giving them an opportunity to pause and reflect on their own, I found to be really useful in people's ability to then engage in conversation. Another piece of feedback that I've received about my course is that we need to be comfortable with silence. People need to think about what we're talking about. People want to be thoughtful about what they say, and allowing some time to write gives space for processing that might facilitate the verbal communication afterwards. And small groups, of course, I mean, this depends on how big your classroom is to start, or how big your class is to start, but certainly small group conversations will help to promote trust in the space. Getting to know each other a little bit better, making sure that you're changing the small group composition can be really helpful. Again, in making sure that students start to develop a sense of community as they're having these difficult conversations. Next slide, please. And then checking in and debriefing. So as I mentioned, there can be a lot of pauses in conversation about race and racism. And it can be true too that there is conflict that hasn't yet been verbalized. And we want to create space for all of these things to come to the surface. As an educator, I certainly have been guilty of, when there is quiet, I make an assumption that it means that the group is ready to go and move on. But I've started utilizing simple Post-its for the class. I give them red, yellow, green Post-its so that when I feel like we're discussing something really heavy and there's quiet, I do a check-in and ask people, are we ready to move on to another topic? Next slide, please. So the next few slides are on facilitation skills. My own personal experience, and I think experience in talking with other faculty members, it's pretty clear to me that many faculty are unsure of how to facilitate conversations that can be challenging and difficult. And I wanted to share some resources that have been useful for me. The first one is Singleton's Courageous Conversations. This is in our list of resources. And, there are 4 basic agreements that that make up the Courageous Conversations. 1, asking the participants to stay engaged, remaining morally, emotionally, intellectually, and socially involved in the dialogue. Sometimes this can require a reminder of the appropriate use of devices, especially in this space. The second one is speak your truth. We ask people who are having the conversation to be open with their thoughts and feelings, and to expect to experience discomfort, and know that the discomfort is a reflection of the divisiveness that currently exists in society, and that what our intentions are in bringing this conversation and the discomfort into the classroom space is to have dialogue, and that through that dialogue we can lead to change and we can have healing. And I wanted to take a moment, and say again, we traditionally at UCSF, we have had a single disparities course for our students. And one thing that we're considering is separating for some of the classes, bringing the students that identify as students of color into a different physical space. And I think part of this is because healing needs to take place for students that have experienced discrimination, bias, racism, and then for those individuals that identify as white, there is a different kind of healing that's going on. The fourth agreement for the Courageous Conversation is that the participants expect and accept non-closure. So we're going to have to spend a lot of time not knowing what's next. As midwives, I think that this is something that we develop as a skill set, quote, hanging out in uncertainty, not rushing to quick solutions, letting things evolve as they may naturally evolve with careful facilitation to keep things on point. But these conversations about race and racism are not simple to resolve. And so we may all leave the room still processing. Next slide, please. Brave spaces. So a second reading that I found very useful is Arau and Clemens' Brave Spaces. It's a chapter in a larger book, again, in the list of references in our slide deck. Brave spaces refers to a contrast of brave versus safe space. So going back to the idea that in a safe space, individuals may feel entitled to be comfortable. It is not in line with the efforts that we see as necessary to promote change and growth, which is becoming uncomfortable. And so this concept of brave space shifts us away from safe space so that people can, to encourage people to be brave, to say things that may be true and kind, but not necessarily nice. Having the ability to be honest with each other. I've already mentioned the importance of creating ground rules collectively. Some ground rules that Arau and Clemens recommend is controversy with civility as opposed to agree to disagree. The point of this ground rule is to make sure that individuals are aware that the disagreement doesn't have to just sit in disagreement, that we we should continue to explore when we have disagreements. Second example of ground rules, owning your intentions and your impact versus taking things personally. So I think we commonly hear, don't take things personally, and Arau and Clemens have invited us to shift that so that speakers are owning their intentions and aware of the impact that their words have. So it is, there are personal aspects that are important to reflect on in the things that we say. If somebody responds to something that I have said negatively, the answer is not for me to take it personally. The answer is for me to examine my intentions and my own impact. And then understanding a common ground rule that comes up, respect, looks different for different people. So when you are setting ground rules, if respect, and I imagine respect will come up, it should come up, respectful communication, invite the learners to dive a little bit deeper. What does that look like? What does respect look like for each individual? So encouraging active consideration of why folks choose to participate or not to participate has been presented in other ways. One way that I have heard this before is the step up, step back. So when as a facilitator, it is our role to make sure that to encourage individuals that may be usually more quiet, to give them space to step into, to share their truth, to share their thoughts. And for those individuals that may be dominating, to ask them to be mindful of how much space they're taking up, and allow others to speak. And finally, exploring the difference between personal attacks versus challenging an individual's beliefs or statements that make them uncomfortable. So challenging an individual's beliefs, example of that would be, I find that idea to be heterosexist, which would be really different than you are a bigot as the personal attack. Next slide, please. And then finally, another tool that has been very useful for me as a facilitator is PV's strategic questioning. And I want to say that each of these facilitation skill slides could be a class in and of themselves. Strategic questioning addresses, it's a beautifully written piece. It addresses ways in which we can express curiosity when we're having a conversation about race and racism that allows us to dig deeper into what people are trying to say. A strategic question is, it's not a yes/no question. It's one that really tries to get at the heart of what the person is trying to say, saying, tell me more about what you mean when you say this. When I heard you say XYZ, it makes me think of something, fill in the blank. Is that what you mean? So it is really common that in conversations about race and racism, people get, conversations can get stuck when one thing is on basically just a single statement that may be off-putting and offensive, and it's important to continue to explore. And so it brings me to the next slide. I just wanted to briefly share with you a tool that the UCSF School of Nursing has developed over the years called HEALS. It's a structured way for faculty and students to identify when a statement has been made, how to identify and address when a statement has been made that raises assumptions about another person or a group of people in a way that could alter how people receive healthcare or how people receive their midwifery education. So HEALS stands for HALT, as in pausing the discussion, ideally in the moment in a timely way. Engaging with the issue, talking about, for example, when we do role plays with HEALS, one of the common scenarios that we discuss with students and faculty is, imagine in a course where you're discussing diabetes, a student makes a comment about, oh, well, the Latinos have such high rates of diabetes because they eat all those tortillas. And it's something that has, of course, assumptions behind it that impact the care that we deliver to Latinos. And so it would be important to halt the discussion before going on to talk about hemoglobin A1C. Stop there and say, something was said that I want as a group for us to discuss a little bit more. Engaging with the issue. Who is it that could be affected? So in this statement, what are the ways that it could be interpreted, and what are the biases that are embedded in that statement? A is for allow there to be discussion, opinions, perspectives, reactions. L is for learning or listening. Make sure that in the classroom there is active engagement in what's going on. And then synthesis is the S. Why does this discussion matter? The faculty having a responsibility to summarize kind of what the conversation has been and circling it back to the impact and why even seemingly innocuous comments can really actually have a depth of negative repercussions. So that's the conclusion of our presentation. Next slide. I want to thank you for joining us, and this is actually pretty amazing. We intended to have 15 minutes for Q&A, and here we are at 15 minutes of time. So Kristin, Kristin, if you have questions, we're happy to take them.
Sure. And at this point, we have just two in the chat box that I can see. So we'll start with the first one from Audrey Levine. She said she's wondering about the potential benefit, and I'm not sure if you were suggesting separating out, but she's saying the potential benefit of not separating out experts and newbies when providing space for processing and conversation, including that so-called newbies might bring in new insights and experiences that the so-called experts could learn from.
This is Kim. So I think that there are pros and cons to having the experts and newbies together. I do think that it is, as you're pointing out, an opportunity for people for peer education to go on as well. And I think that it is, it's not an absolute that they should be separated for the whole class, but I do think that it changes the dynamics, and would say that at least for part of it, it would give more space for those people that feel like they are early learners to ask the questions that they may be more self-aware and not ask in the audience of members that are more experienced in talking about race and racism. And this is coming, actually, it wasn't my gut initially, but this is coming directly from experience in teaching a course where the students felt like they were in company of they were in very different learning places about this. And also I think another dynamic that came up was that the class, our foundational class, is the first quarter. And so we had a group of students that had not yet developed trust or community with themselves. And so they were having a hard time being honest and really being themselves. So an additional dynamic to be aware of. It may be mitigated if you were to have that conversation with a group of people, even if there were experts and newbies, if they had already developed trust within the group.
Great. And I don't know if Leandra or Brittany want to say anything to that question, and then we'll give Audrey a chance to clarify if she had any clarifications.
This is Leandra. I think that I think that also what maybe I'm implying, but maybe not, or I'm implying from this question too, is that it often, that expert and newbie line, especially in the healthcare class, tends to be also divided along race lines, right? So it's students of color that have had to have these conversations with themselves, with their families, with clients, are kind of coming to a head with maybe people who did not necessarily have to have these conversations. And that is very challenging for an educator, I think, to have to meld those two groups together. I'm not saying that they're the same thing, but what I am saying is that often tends to be the divide as well. And I would vote for making spaces for maybe separate for separate discussions to happen, but also for those people to come, for those two groups to also come together. But I just wanted to kind of name that as well, is that at least it has been my experience that people who have who come in with kind of this a little bit more comfort level about the subject tend to be students of color, or even white students who have different experience different oppression due to their sexual identity, gender identity.
Thanks, Leandra. Maybe we could go on to the next one, since we only have a few minutes for questions. And in the chat box, if we need more clarification, please let us know. The next question: could you give an example of the framing of questions for a pre-course survey of students that assess their level of knowledge and comfort with the topics of race and racism?
Kristin, sorry, could you repeat the question?
Sure, yeah. I believe Cynthia Ballou, sorry if I'm mispronouncing your name, and I can unmute you too, but could you give an example of the framing of questions, that pre-course survey, I believe, Kim, you mentioned, of students to assess their level of knowledge and comfort with the topics of race and racism? I think she's asking for some examples of how you might frame questions for that survey.
Hey, Cynthia. So great question. And this is actually something I'd have to think about a little bit more. I had a lot of feedback that this would be an important thing to do with our class here at UCSF. And it's my intention to do this for our next quarter, but I will be totally honest with you all that I have not yet created or previously implemented a survey that does this. Are there particular aspects, Cynthia, that you think might be difficult to word or to collect this information?
And Cynthia, I'm happy to unmute you, but I don't know which one you are. Maybe you're on the phone. Shoot.
C. Ballou.
Is she? I thought I saw that, and then I didn't see it go away. I saw it. Sorry, I'm looking here. Shoot. I wonder if she fell off. I'm so sorry. It might be a conversation we can continue as a, an educator call as well. And I'll keep looking to see if I can unmute.
Yeah, and one of the, so just sort of off the top of my head, I think that what I might do is actually look at some of the specific terms that we introduce. So ask about familiarity with microaggression, familiarity with implicit or unconscious bias. What do people know about structural competency, structural humility versus cultural competency, et cetera? I think that it would really be probably targeted towards some of the core concepts that we address in the class: power, privilege, et cetera.
Great. I think that's a good example. And I have unmuted everyone on the phone. So if you want to be able to ask a question, you could be able to do that. Please mute yourself, though, if you're not asking a question, so that it will be quiet for the rest. I'll go ahead on to the next one for now. Oh, go ahead.
I was just going to say, Kim, if you're going to put that together, this is Amy Levi. It'd be great to have a bunch of people work on it. I would volunteer.
Great, Amy, thank you for that. I think it's a wonderful idea.
It would certainly be great if it was a tool people were willing to share to have that. I'll go ahead on to a next question. I believe those of you on the computer can actually unmute yourselves if needed. So I'll say that, but I'll go on to the next question in our list here. And let me try to get them in the right order. Curious to hear your thoughts on mentoring efforts for students from marginalized communities. I don't know if any of our presenters have.
Yeah, this is Brittany. Yeah, the thoughts of having mentors who maybe identify or don't identify as a person of color is an interesting topic. I know I myself actually have an advisor who does not represent or does not identify as a person of color, but I've been feeling very supported by her and the relationship and the mentoring. But I know that there is something to gain also from other ways of connecting with other midwives of color in the area. We've actually started a Midwives of Color in the Bay Area group where we connect with other either student midwives and other midwives who are practicing who identify as people of color. And we've had like a few different gatherings, which is really, it was really phenomenal just to be in the same room with other people who've done shared experiences through the student life, and also now working as a midwife of color to hear their experiences. So that's kind of one way that we've done it. So kind of creating our own circle and spaces to hear the experience of other midwives of color who have kind of gone before us, and understanding more about there's local issues and things that are happening even in our own backyard, even in the Bay Area here in East Bay. That's been really helpful for me as a student.
Thanks, Brittany. And I believe we'll have to do more on, maybe a webinar on mentoring or a educator call on mentoring at some point as well, because it's an important topic and one that I know, of course, NACPM is a little bit focused on and all of that as well. And I'm sure ACNM as well. I know you have your e-mentoring program, so thank you. I'll go ahead, since we just have a few minutes, to another question. Do you have comments about addressing the growth spectrum of faculty and staff and how they may engage with each other where conflict may exist on the issue of race and racism using these facilitation tools? So I think that's Jody Palmer. I think she's asking about how faculty and staff can deal with their own conflict. I'm going to go ahead and unmute you, Jody.
Yeah, I'm curious about maybe some systems we can engage to help faculty and staff who are somewhere on the growth spectrum, either newbies or experts themselves, as we navigate these issues in our own institution. So it's it's certainly one thing to talk about engaging the material in our curriculum and threading it through the curriculum. And then also there's that other piece of everyone else in the institution who's somewhere on this spectrum. And, you know, I've just been observing, kind of sitting back at my own institution, kind of watching the engagement between faculty and staff who are just in different places, and how we might support an environment that is kind, but not afraid to have these difficult conversations. Like, what kind of systems could we, or structures maybe we could engage in that could support that? I'm just curious about your thoughts on that.
This is Leandra. I think that as much as I think, yes, we should promote a kind environment for that to happen. But I would go back to Kim's point about brave spaces and making people uncomfortable and kind of making that a requirement. One of the things we, as presenters were discussing about the theoretical frameworks and the need for theoretical frameworks is to necessarily set up this environment where we kind of all are jumping off from the same foundation, right? So I don't know if you guys are at the stage where you are just starting to have conversations about why we should care about racism, right? Or it's maybe a more developed conversation. But I think raising the standard for staff and faculty to need to be competent in that manner is I think a first step, and not one that I think unfortunately has been as uniform amongst all education programs.
And I'll just add too that at UCSF, I think we're lucky in that it is a very explicit and visible value and part of the mission that we're addressing discrimination and bias head on. And so there is an expectation that all faculty participate in ongoing courses and faculty development around basically implicit bias and microaggression to raise awareness. So the structure, I mean, from the top down, inside out, it has to be committed to this as well.
Yeah, thank you. And we are at 12:30, so I will say that I posted two things. The first being a little confusing in the chat box. The second is some links. Sorry about that. Asking if you all could please evaluate this webinar. It's helpful to know what works, what doesn't, what ideas you have for the future. And there's also some links to additional information about upcoming events. We do have one more question. I think it's probably okay to take that, and then anyone who has to go can go. Otherwise, I definitely, before I let others leave, I want to thank our presenters so much for all this fabulous information. You have generated a lot of great questions and comments. The one other question we did get that maybe we can spend a few minutes on from Marika. I sometimes talk about the systems that fail people of color versus people of color somehow failing to care about their own health. This helps me frame the accountability of the systems and the structures of healthcare versus diet and non-compliance, et cetera, as the reason for health outcomes. Can you model some language regarding resilience and dignity of communities of color in health efficacy? Because she feels worried she's creating a victim view.
Hi, this is Brittany. I was just thinking maybe one thing that would help would be asset-based. I'm not sure. Asset-based kind of strength, kind of what we were talking about, strength-based approach, including resilience and understanding kind of picking out different things that we can appreciate and even praise and admire within the cultures that we're talking about. I'm not sure how to do this in the classroom yet without sounding corny or weird, but like, how do we praise and give worth and like time spent on looking at and honoring just the strength of a community that we continually talk negatively about. Yeah, so something around that. I know maybe Kim might have something to add on that one, but those are just my thoughts of how to increase maybe language as far as like what is the assets, or maybe even ways of saying what the community, even if you're in a local clinic or you're working, or if your school is connected to a clinic, what are locally, like what are the assets in the area there? How is the community, how do we as a school or we as a profession benefit from the communities that we're in and the populations that we serve? Those are just some thoughts I had.
This is Marika. Thank you for that, Brittany. I sometimes end up telling just stories about initiatives in our different communities and things that people are doing that are resilience and dignity based, that are addressing the needs of the community from within the community. And there's really always some powerful examples. And yet I'm not of that community. And so I'm telling someone else's story. So I can talk about how I admire these efforts or whatever it is, but I am constantly aware of not wanting to present whole communities as being victimized by the system, even though I want to hold that system accountable for its discrimination and racism. Does that make sense?
Marika, this is Leandra. I think that is exactly a response that I would want as a student and as a person belonging to these communities, is to give platforms for initiatives. I think sometimes when we kind of put out this myth that marginalized communities are not helping themselves or have not already developed ways of surviving the systems that oppress us, I think we need to just like get rid of that myth, right? Like actively say that is actually not what's happening, because we still exist and we're still having babies and we're still making families and we're still making communities. So instead of that, it's like, how are people of color overcoming the systems that fail us, right? And that is the discussion that should be had. And yes, it might take a little bit more of research because it's not out there, or might take a little bit of like funding because it isn't out there. But I think we need to just kind of reapproach this and get rid of this myth that people of color are not already doing this work for ourselves. That's out there.
Right. Thank you.
Great point. Thank you. All right, everyone. Well, thank you again so much for participating. I will be sending out a follow-up email. So as long as you are set up with MailChimp, you'll receive follow-up information, giving you that link to the Survey Monkey. Love your feedback on this webinar and suggestions for future topics for the webinars. Please put on your calendars August 29th. We have an equity strategy and collaboration call for midwifery educators. As I mentioned, the theme will be discussing scholarships for underrepresented students and apprentices. Also, talking to some people who already have started scholarships or who, have done that sort of process, so we can learn how to do it at our own institutions if we're interested. September 21st, we'll have Keisha Good doing a webinar. Some of you may be familiar with her dissertation, Birthing Blackness and the Body. This will be a follow-up because she's starting new and follow-up research. She's working on it at the moment. So we'll get to have an update from her in September about what she is learning in that new process. And then November 17th, especially for preceptors, infusing equity and diversity into clinical teaching with Carlene Wilson Mitchell. So hope that you can join for all of those. And if I don't have your email through MailChimp, you can log on to the website equitymidwifery.org, and you can sign up there to make sure that you receive emails, including the follow-up email for this presentation. I saw that Kristin had requested the reference list, I believe is what she was asking, or the resources. So I'll speak with the presenters about that and share with you what I can. Thanks again, everyone, so much, and for the presenters for taking the time to put together this fabulous webinar.
Thank you.
Thank you so much.